I'm John Paul Carpenter. I'm one of the consultants in the cardiology department at Poole. I'm clinical lead for the service on the Poole site, and on a day-to-day basis I'd be looking after patients on the ward. My area of interest and expertise is mainly in cardiac imaging, and so I do things like echocardiography, ultrasound scans of the heart, stress echo scans, CT and cardiac MRI. So cardiology looks after anybody who's got a heart problem, whether that's chest pain due to coronary artery disease, or whether somebody might have a heart rhythm disturbance or heart failure where they've got an impairment in the pumping function of the heart, or valve disease. There's lots of different bits and pieces to that. Within cardiology there's a number of different specialities. There's people who look after coronary artery disease in terms of coronary intervention, people who look after heart rhythm problems, people who mainly do imaging of the heart, people who look after heart failure, and also there's a speciality which looks at people who've been born with plumbing problems, congenital heart disease, in conjunction with our teams in Southampton. At present, we have a system where the cardiologists take part in the general medicine on-call rota, and so if there isn't a cardiologist on call that day, you won't necessarily see a cardiologist when you come into hospital. That happens at weekends and out of hours, and it's only by chance that there might be a cardiologist on call if you come in with a heart-related problem. What we envisage in the future is that if we change patient pathways so that everybody's admitted to one site, there will be a specific 24/7 cardiology consultant on call, which enables everybody to be seen in an entirely equal way by a specialist as soon as possible.
My name's Dr. Richard Balla. I'm a consultant cardiologist and electrophysiologist, which means that my area of expertise, if you like, is in people that have problems with heart rhythm, and those are the patients that I see most of the time. So I think at present, when patients come into Poole Hospital, for instance, if they present with a heart attack or with chest pain, or if they present with problems with their heart rhythm, they invariably have to get transferred across here, and then we have to assess them fully here, because the consultants with an expertise in heart rhythm problems or with chest pain tend to be based here at Bournemouth. So therefore, if we were one network, it would allow patients to be accessed straight to here, and they would get treated much more quickly, and then they would be discharged earlier as well. I think one of the other advantages of us working together is it allows patients on the Poole side of Dorset to be able to access the expertise potentially of heart rhythm experts, where previously they'd had to come all the way over to here. We hope to be able to offer specialist clinics over at Poole in cardiac rhythm management, such that those patients can access those services over in Poole and not have to travel so far over here as well. It also allows expertise generally in cardiac rhythm management to be at both sites. Some of the staff that are involved in cardiac rhythm management, cardiac electrophysiologists, are a very scarce resource, and by allowing us to pool the staff from both sites will allow both sites to be able to staff better and allow patients on the east and on the west to be able to access cardiac rhythm management services better, in terms of follow-up clinics for devices, for example, and also in terms of specialist clinics as well.
From the staff point of view, we have staffing problems across the board because we don't have enough people to be cardiac nurses, for instance. We've got vacant posts, and actually coming together would give a really strong message to the local community that we have a centre of excellence, and would help in terms of our recruitment, retention and working together going forward. I think that we have a real opportunity to develop things for the future.
We'd want to put Dorset Cardiology on the map, and we'd want to be known as a world-class centre. We have a very good reputation as it is, but I think we would have an even better reputation as one organisation. And we would want to attract the very best people from around the country and from further afield to want to work here, and for us to practice the most up-to-date evidence-based medicine in cardiology.